body talk. We dey talk about different sickness, wetin dey cause am, treatment and self-prevention. As inside the program well body talk, we dey always get experts dem for can talk about different sickness. And inside this edition of the program well body talk, we studio guest na Dr. David Jallo, in a specialist obstetrician gynecologist and senior registrar at the University of Salon Teaching Hospital Complex. And today inside the program well body talk, we dey talk about reproductive health and infections, STI, yeast and UTI in the rainy season. And where they bring this edition of the program well body talk, my name na Karifa to Conte. Remember, say yourself where they listen and watch you live na Facebook, you go be part of the program. But why go send a comment or text message to the number 077981981, 077981981 at the number where you go call and ask question or self make contribution at the program or self you know where the democracy or YouTube page. As inside this program today I don't tell now they talk about reproductive health and infections. And my studio guest when Dr. David Jallo. Good evening and welcome to the program.
Good evening, my sister, and good evening, family.
Okay,
Thank
and
you very much.
as today inside the program, we don't tell us so they talk about sexual transmitted infections, yeast and UTI in the during the term of this rainy season. So, Dr. Jallo, you can start for tell family what this STI.
Okay, family, I believe once more again. So, we the time for talk about STI. STI actually is what we call just a short name of sexually transmitted infection. Some people call them sexually transmitted disease. Well, simply now something where you get them from person to person to sexual intercourse, either through vagina, anally, or oral sex. And it can be caused by organisms, that can be bacteria, virus, or parasite.
Okay, you don't talk about this STI as being a sexual transmitted infection, and you don't say person they get and two person to person when doing sex. Then you mention one when a oral sex.
Yes.
So what's it Andy?
Well, oral sex now a form of practice where they use the penis they use the penis to either they suck you or they use the penis put it inside the woman's mouth and then perform sex just like how they do to the vagina.
So, okay, you don't mention that the way na the one way say na oral sex where person they suck like the man in private parts. So how people go and they wonder now for know how STI they transfer through that.
Okay. So you get things that we cause STI, and some of them infections they are to call them bacteria, virus, or it can be even parasite. So if I can mention a few, you get what they call like syphilis. You get other one they call Trichomonas vaginalis. You get what they call herpes. You get what they call human papilloma virus. You even get HIV. So when you look at the human and sexual part, it actually get mechanism in the way they for help them for protect them against certain infections that really come. So what can happen is that for women where they within the reproductive age group, you cell them line with the inside the vagina, then get something they call glycogen, where you get small thing like carbohydrate. So a woman they produce what called estrogen. So that estrogen it help for convert the glycogen to something they call lactic acid. By so doing, it keep the pH of the vagina acidic. Not the acid or the pamotuka or battery who will burn you, but in a level that let me say between 7, 6, 7, and 8. Short away that it protect the woman in case of any infection we can then it will get into that infection. But then what will happen because there is a change in that pH of the vagina, because as mentioned, I say for be acidic. If it move from acidic medium to any other medium when an alkaline, or something by any other means, something doing sex, or something due to some certain practices human they practice, so it lost the protective mechanism. So it's easy for many infection that I mentioned, either syphilis, human papilloma virus, It's either through normal sexual intercourse, oral or anal, for make you get in contact with those body fluid and wake it within those area for make the man or woman get that sexually transmitted infection we don't just talk about.
Okay, so now let's look at wetin are the signs and symptoms of sexual transmitted infections.
So the signs and symptoms can be vary because na plenty organism there. So we're not going to talk about each and every one of all of them. But to just bundle everything, just put all into a context. So one, it could be they will get some burning sensation. Then certain if it wet, it could get small pain with the wet. And then it could itch, it could get copious vaginal discharge. Where sometimes it could be yellow, it could be green. It depends on which organism they cause them, as I say. So just they put everything together. It will get some blister then, where they within that reproductive organ, either inside the vagina. So as they say, not only for woman no more, it can even be for man. Because nothing when both man and woman can get her. So for the man by penis, sometimes go see blister the day, or sometimes two in wet to outside the wet they come out. You go see some discharge in there, where it looks sometimes yellow or red. And for man, sometimes they wet in the hotter, or sometimes they make it go they use frequent time for go wet, as the case may be.
Okay, so how long did it take for man for no say don't get sexual transmitted infection?
Well, looking at the anatomy of the man and the woman are two different anatomy. The man get a urethra very long because the man in penis long. So the urethra basically na the conduit where they allow for baby urine come outside. So and looking say the surface area of the man in penis or reproductive organ is not too that big, it's not too that wide. And for make the man experience them, it can depend on certain risk factor the man get. You understand? But for a healthy man, it will take a while because those infections can ascend themselves and find themselves in specific area of the man or woman. So for man at times, it will take a while for make it see them. No, sorry. For man, it goes too quick for make it see them because in surface area is small. But for woman, because again large surface area, it will take a longer time because it have to go to different structure then within the woman reproductive state before the woman begin get the symptoms. So woman will get no symptoms, but some will begin get, as I mentioned, burning sensation, itching, copious discharge, where they wet, they feel pain. The man in symptom can be so quick when he gets sexually transmitted infection. It could take matter of week. It don't begin experience and see it get some burning sensation or some itching, or you could see some blister within the penis. That the man could not say, hey, I don't get infection.
Okay, so person they get sexual transmitted infection without get any of them symptoms then they?
Yes, you can get them without getting the symptoms then. Because as I say, it can differ from one person to another person. So some people the immune system is very strong, so it not going to manifest as quickly as it is. But it will get the infection. But the only thing you will know is that probably if not for woman, because the infection there, when the chronic part of the woman, it will affect certain organs there, we're responsible for making the woman get picking. So it's only when you go to doctor, they do some investigation there, they find out say something don't go wrong. Even they can ask say if you don't get any infection, you say I don't get no infection, no symptom like that. So not in all cases, but one or two symptoms then go there until when he experience, but somehow until he take medicine, he pass away without even knowing. But the common symptoms, as I mentioned, that the one that we don't just mention, it will always date presently for many women who say don't get sexually transmitted infection.
So now look at waiting at some of the warning signs then we person for always for the watch out for when encounter sexual transmitted infections.
Well, one, if you get any burning sensation within your vagina or inside your vulva, on both sides, not only one no more. It can be like they get some copious vaginal discharge. Then copious vaginal discharge, it can be like yellow, it can be green, it can be even white, but very copious, as the case may be. And then sometimes they wet. The only time where you get pain, when they wet, then they get pain. Where somebody can call the garden can call them actually splash dysuria. Because of the blister they don't form within the vulva or the penis, so as wet structure no more, it get pain. So that can be one of most of the common signs that we can get. Fever self can come, or fever can be hand symptoms that will go show itself. But those are the initial symptoms that will come, we will show you don't get sexually transmitted infection.
The continue for the it's been at the program. A name na Dr. David Jallo, in a specialist obstetrician gynecologist and senior registrar na the University of Salon Teaching Hospital Complex. The program na Well Body Talk and it come to you live from the Society for the Democracy 98.1 FM. You self can be part of the program by way go send a comment or text message or self call the number 077981981 077981981 and the number where you go call or ask question or make clarification or contribution where you want to make na the program as we get the experts na the studio with we as today inside the program we dey talk about reproductive health and infections wey get for do with sexual transmitted infections, yeast and UTI during the term of the rainy season. The program na Well Body Talk. It come to you live from the Society for Radio Democracy 98.1 FM. So Dr. Jallo will still lay on the sexual transmitted infections. STI get anything for affect the human infertility?
Yes. It can see for affect human fertility. So as I mentioned, some of the bacteria like Neisseria gonorrhea, chlamydia, Trichomonas vaginalis, herpes simplex virus, and then human papilloma virus. Well, for chlamydia and gonorrhea, because what they go do, they go lead to what we call cervicitis, where the cervix one at the door where the pikin they come out from a woman or woman immense, that door side immense they come out. It will lead to ascending infection. It will lead to infection inside the womb of the woman, and that infection will go to the tube. And when you go to the tube, it will cause scarring and it will cause some inflammation products, such as that. The tube, now the conduit where fertilization don't take place, for many people can plant at the uterus. So you will find out say the woman don't go get belly because the tube don't let it block, or you don't get some tube or water don't flop there, or for some reason, even if the woman get belly, it can lead to ectopic.
Okay. So you mentioned one again when the human papilloma virus. How than they self dey for tap woman not for born pikin?
Human papilloma virus, well, it not get really something for affect your fertility per se. But human papilloma virus, what studies don't show say, it depends on the type. Because I say that it's sexually transmitted disease or infection. So if you get them, it'll be like some big lesions where they see either at the penis or you will see them within the vulva of the woman. So now a risk factor depending on the serological type, because you get different type. You get 8 and 9 where not much get problem. But the one way the high number like 33, 31, then will lead to make you get cervical cancer, and then it even lead to make a vulva cancer. So now that it could cause if untreated or you not do something earlier on for make you go meet the doctor and see say now you get.
So it also affects man infertility?
Well, it affects man infertility directly. Man, yes, the fertility will be affected not by human papilloma virus, but if you get Neisseria gonorrhea or chlamydia, because it will happen when you get them, it ascend, they go through the conduit of whose size sperm they come out. Because the sperm itself gets a vast difference, you get the like ejaculated dot. And then you get the testis. So when that infection go right to the structure, then they reach that the testis, it will cause testicular infection. So the testis they inflame because the testis now get small production of sperm. And so if it happens to affect that area, they, or for some reason the infection affect the conduit, all the sperm they go, so sperm no go come out. So they lead to obstruction. So you go the sex, but sperm they come out. Only what they come on as semen, ordinary water. So it will cause infertility to the man if that infection reach there.
Okay. So in any way STI the how severe in the?
Well, it depends. If you're able to notice early, then it can be treated as early as possible. Mm-hmm. But if you let it become chronic, then it will become very severe infection, and it will cause a lot of complications, as I mentioned. For the woman, infertility. If it not cause that, it will cause pelvic abscess. If it cause pelvic abscess, it will lead to a thing. Some of that sepsis will happen to the woman. But if very severe, if you not treat her, or take immediate measure for make sure say you treat the infection, either man or woman.
But in the men?
Yes, it can be treated.
Okay.
It can be treated. Not all. Some of the virus cannot be treated. If you get herpes simplex virus, where they make like blisters, either at the penis or at the vulva, But then blister is different. No, you get for no say well. Now I can say I'm not going to explain all in a proper way because them different. They make blisters the way they gather together, and when you bust them in the heart, for what you go do, the woman will get the belly, but it will affect the pikin. And if you affect the pikin can die. You see, and then because in happy when it happen, it can come back in the way completely. It doesn't suppress them. So in some situation where you dey inside the first or second trimester, depending if you get herpes, it will affect the pikin. So in other words, you even could make the pikin not grow or the pikin die.
Okay. How important it be for they do a regular testing for STIs, especially for people who are active in sex?
Well, if I one of the prevention and in the we find we want to say you do regular checkup for make you make sure say you don't get STI. It's so good, it's so important because they keep it to you say I don't get problem. Because as we mentioned earlier on, not everybody will get the symptoms. It will show clearly. The woman, the reproductive system, they get a wide surface area. So it will take a longer time. And depending on from one individual to another individual, sometimes the spread will show quick. The time when you show yourself now, it don't cause a lot of problem within the reproductive system. So it will be good for once in a while, you check yourself and see if there's any problem.
So how like for people away married, how they able for protect themselves from sexual transmitted infection?
Well, first of all, just take prevention measures then, because some of the risk factors where you for me you get sexually transmitted infection and they multiple sexual partner.
Okay.
You there, to cause them. If we don't get them before, it will happen. There's certain disease condition they will get like diabetes. You know, it can allow for make you get sexually transmitted infection. And then certain things them, towards them, or things that they use, spermicide, either for prevent pregnancy, where they can insert by the woman, also can cause them for make you get sexually transmitted infection. So the most good thing is, well, for a married woman, well, una can screen on herself and see una not get her, if una get her, una treat herself. Because under the treatment, now one of the things if a woman get her, then a partner for be treated, so that they don't go continue for they infect themselves.
Okay. So again, waiting at some of the prevention for possibly making not go get the STI.
Well, abstinence, if you not sex, you don't get them. Though not in all cases, you can get sexually transmitted infection even without sex. Maybe fomite, somebody get them, it go wet some side, then you likely go sit down there as a woman, you can get them. So one other one they then regular checkup is that one the other thing that they do. And then you do hygiene, vaginal hygiene. So woman and the whole day just something one just normal, like go well. You understand? Then probably all along involve it not look too hygienic, and that they allow bacteria for thrive, other infection for thrive and make you get them. So for do basic hygiene, a very good and regular checkup, and just be faithful to your partner, and make sure say yourself, not there, not there, and so that at least you never get them, because now some of the preventive measures that we go take.
Wetin person go do like if some of the signs and symptoms we just mention people they experience them kind of day?
What you go do?
Yes.
So in the first place, basically, what I can see people like you do, they abuse antibiotics. Because then I don't mention, we're not going to talk in detail how to treat them. And so taking antibiotics does not actually treat them. Sorry. So what you go do, because once you see a doctor, based on the signs and symptoms we present, he can able to say, now this person get, now this he get, now this he get. Because each of them get a clinical presentation where they present themselves. Happy is getting your way where they present themselves. Woman popular getting your way they present itself. Syphilis getting your way they present itself. Because in syphilis, you could just see one solitary lesion when a wound we go see. You know? Then each and every one of them get the way they present themselves. So once you take the history, they're going to say, now these are the things say they affect the person. In situation where not so, they can take what to call vaginal swab. For many do thing, culture, sensitivity, and gram stain, make them see what in the actual bacteria cause them. So if you just they take antibiotic like that, you go find out say na substandard treatment you get. It go treat you for a while, but not properly, because not to the problem now they for treat. So now that you will do. See your doctor, make your doctor examine you, make you do some test them. So from then test the day, you go know say now this you get or now this you get, and then you go treat that problem.
Okay, sexual transmitted infection in any way can cause odor at the woman in private parts.
Yes, it can be offensive, it can get offensive odor, it can happen. Because if you dey get mucopurulent discharge, that discharge dey comot. You know say the woman anatomy quite different from the man. So with a while, because you not treat am and the infection dey continue for persist, so you go begin get some odor.
Okay.
So that's why in fact since the doctor can do for you, go wey examine you with a speculum, look at all the area them, then you do the manual examination. You can just try for see the odor of the discharge for you for tell, because some dem get specific odor wey you go know say na this bacteria dey cause am. But generally, if untreated, it continue and persist, it go be odor, the odor go dey in that area dey anytime for the woman.
Continue for David with me at the program. In name now Dr. Jallo, in Dr. David Jallo, in a specialist obstetrician, gynecologist, and senior registrar na the University of Salo Teaching Hospital Complex. The program now will Bodi Talk, and it will come to you from the Society for the Democracy 98.1 FM. Yourself can be part of the program by way you call the number 077981981, 077981981, and the number where you go call, ask question or make clarifications or self-contribution at the program as we get the experts in the studio with we. And today inside the program will Bodi Talk, we dey talk about reproductive health and infections. Wetin na STI, wetin dey cause sexual transmitted infections, yeast, or maybe some person go wrong experience some of them thing, and then you go call and ask questions or make clarification as we get Dr. David Jallo na the program with we. So Dr. Jallo, now let's go to the other set of the topic wey na yeast. So you can first tell family first wetin na that day.
So yeast actually they call it candidiasis. Actually not to a sexually transmitted infection per se.
Okay.
It happen because of certain conditions that the person gets. So now that it manifests itself. Because naturally the woman get bacteria in the vagina. That bacteria they not there for harm, it just there for protect them. They get the name, but I don't want to mention them because na big word. So what in there that for help any other bacteria we can do for make it get rid of them. So if you get condition like diabetes where they suppress your immune system, in short with that, it they make that bacteria they not thrive. Then if they use things like steroid or sometimes you go to hospital, your doctor gives some medications then where you take, where they suppress certain condition we get, it will make that bacteria they also in function not gonna be look fine. Then certain antibiotics and where you take. Sometimes you take antibiotics, then after you begin see you get yeast. Now just reaction to the antibiotics. Not that na a infection you don't get. And then if you get belle woman, well then they in a state of whereby the immune system, not to say they get bad immune system, there's immunomodulation. The immune system they modulate because they get for receive the pikin for make it day. Then if you get immunosuppression, people don't get HIV. Because they affect that bacteria where they under for protect the woman and keep the pH of the woman in that acidic medium. So once you get time, you begin see this infection. But that yeast they see is different. Because make you not go mistake yeast for other conditions like bacterial vaginosis or other conditions they also don't mention say they get vaginal discharge. So it's a two-way thing. So that yeast infection, what you they get is they get a cordy white discharge, something like chalk. Now you see where they come out. But some instances then you can get secondary bacterial infection. And at times it can coexist with other conditions they call bacterial vaginosis. When not to sexually transmitted infection. When plenty women get, when they just burning sensation they feel within the vagina and then some discharge where they get. So now that's about yeast. We call candida.
So what are the causes of that?
Whether then the risk factor I don't tell you. Now something they happen for more than 12 days. If that not happen, they don't go 12 days.
Okay, so
that's
why
a fungal infection?
Why some women repeatedly they get a discharge when the yeast we just mentioned?
Right. So first of all, you get for clarify first. So you need family see doctor, may they take high vaginal swab, may they look at the microscope, may they find out whether they are yeast or not to yeast. Because if na yeast infection, certain characteristics and the way they show say this na yeast. We call hyphae, can be seen as doctor then Kigal they see they so na yeast. Then if na bacterial vaginosis, we say it's like it got some discharge because most time people they can misinterpret between bacterial vaginosis and yeast infection. If na bacterial vaginosis, then they can see what to call gram-negative rods. They can see some other cells that they call Kru cells. So once you get these two differences, then you can be able to say, okay, now yeast they do it, not yeast they do it. But if you take antibiotics, then you notice they begin get white discharge, think about saying a yeast. If you na patient get diabetes, then they get some white colored discharge, then think about yeast. If you na patient get HIV, think about yeast in that situation. But for just natural somebody who healthy, for me just see yeast normal, it need for make you really find out properly. But naturally a woman always a secret, either na ovulation or whether na some form in doing in cycle, it get small discharge. So that discharge not for be confused say na yeast. Even a pregnant woman, they get vaginal discharge called leukorrhea. E no mean say na yeast, though they can get yeast. But women they can tell say na yeast. Wait, check not to yeast. You see, so yeast get in your way where it present itself, as I tell you. It present that white chocolate like discharge and chalk discharge. Now so they see. Now you go know say this na yeast.
So what are the difference between it and spam?
Different. Spam different. Spam get features then. We make a spam. If you put on a microscope, you get head, you get a body, you get a tail. You know? But it's difficult for me to see out the naked eye.
Okay.
You know, you can't see it with the naked eye. So that will only be the only problem. But it's not two different things.
So man itself they get yeast infection?
Well, yes, you go get yeast infection actually. Or a thrush at the mouth. So yeast infection to the vagina make it happen. It can happen even at the mouth. Or a thrush. That means if you get any condition I don't mention, diabetes, HIV, immunosuppression as the case may be, you could get them.
Okay. So again, now look at what are the typical symptoms of this yeast infection.
Well, itself, as I say, it depends also. You do not get white discharge, heavy one, and then at times they go to cause splash dysuria. Splash dysuria is a condition whereby they call it to attack you. So, because what did the yeast do in some situation then, because of the itching way they happen, so the woman they get some small blisters there inside the vagina. So when they wet, because when they touch the area of the vagina, it they burn. So they go to cause splash dysuria. But if you don't get that colic discharge before you begin to see that splash dysuria, especially when you don't itch a lot, that will happen. So that most that you can see in the woman, we go present with.
So like during this time on the rainy season, if damp clothes person where it gets in any way for affect them for getting
yes, it's possible. It's a risk factor during rainy season because the place is humid at times of time. You wash your clothes, you know even the day are fine, you don't wear. And woman, the anatomy quite different from man because there should be aeration here for the blow around the area. Small safe, the place damp or water don't soak you, not do proper hygiene, then you get risk factor to make STI and you get yeast infection. It's possible.
So yeast infection also gets anything for do like your lifestyle, anything way go make you get yeast infection.
Well, as I don't those things I mentioned as risk factor na them. If you
Yes.
get them, a good safe. It's not really by lifestyle. But what I could say if you get yeast infection because you they try for increase that bacteria say they help woman, where woman get naturally. Lactobacillus vaginalis, where they do. So you can say eat yogurt. So by eating a lot of yogurt, they get rid of the yeast infection.
Okay.
We eat them.
Which type of yogurt? The plain one?
Yogurt. Well, I don't know able to tell you which one, but yogurt will get milk or whatever it is, it help for getting of the yeast infection. In some instances themselves, they can treat them, I don't want to mention here, they get the teeter back. You know, but not a matter for somebody for go begin put your hand inside, begin pull up. By so you go do get other secondary bacterial infection where they go even more than the yeast way you don't get.
So it's healthy for the put hand inside.
No, it's not healthy for put hand inside. Do you not too fine for one man? You get infection. Your fingernail they get a lot of infection, a lot of bacteria. So you go just introduce a day in a simple way. Without even knowing so you don't get infection.
Okay. In name now Dr. Jallo in a specialist obstetrician gynecologist and senior registrar na the University of Salon Teaching Hospital Complex. As students inside the program well body talk, we dey talk about reproductive health and infections, wetin dey cause STIs, wetin na STI, yeast and urinary and transmitted infections. Since we go for look at am later on at the program. The program dey continue and now na time for make we take break. Well, family, I hope so now enjoy that song then at the program. The program now, well, Body Talk, it come to you live from the Society for Getting Democracy 98.1 FM. And where they being told now this edition of the program, in name na Karifa to Conte. As today inside the program, we dey talk about reproductive health and infections, sexual transmitted infections, yeast, and later on we dey look at the urinary and transmitted infection during this rainy season. As we get the experts now, the studio with we when our Dr. David Jallo, in a specialist obstetrician and gynecologist and senior registrar at the University of Salon Teaching Hospital Complex. As today we dey talk about reproductive health and infection. Famble, you can now call the number 077981981, 077981981 at the number where you go call and ask questions, make clarification or self-contributions. As we get the experts now the studio with we're going to respond to our questions then. So Dr. Jala, we don't talk about STI and yeast. So now look into the urinary tract infection. So start for tell family first waiting at that day.
So urinary tract infection are infection that affect a particular structure where they call the urethra. The urethra, then are the conduit, woman the wet, where they come on, woman the wet, where they see the way they come on. That urethra, that is responsible. Then you get the bladder is a reservoir where they contain urine. You just they keep an normal. Then you get the ureters where it connects to the kidney. So now from there, inside urine they produce from the kidney, they go through the conduit of urethra, they can't see now what now the bladder. So when you feel for wet by through some process they call reflexes, then you find out say the urethra get a valve where they open, they allow urine come out. So we'll talk about urinary tract infection that affect the urethra, the bladder, the ureters, and the kidney itself, the mechanism or the structure, the particular organ where it's for produce urine.
Okay. So what is it called urinary tract infection?
You get plenty infection. First of all, you get risk factors at first. You know, in medicine, always risk factors are there. We tell you say that because of this, you get this one. As I say, your structures are always protected for help you. But if you get certain risk factor, then you know go walk the way for walk. So some of the risk factor, first of all, if you get any congenital abnormality within the urinary tract system, because the urinary tract system and the reproductive system, they're close together. So even embryologically, inside where they inside my belly, where they form, then they near. So if you get problem with one, problem go to other one. So like situation today, I mentioned say you get the ureters. The ureters are the conduit where they bring the urine from the kidney to the bladder. It can duplicate itself in some situation. Some it can be obstructed. You know, so any situation like that where they happen is a risk factor for making get am. Then if you don't get urinary tract infection before, where you don't treat fine, you don't go take medicine no more. You don't go to doctor, they not see you fine, they not do any urinalysis, culture, sensitivity, and gram say for know which particular bacteria cause am. You just substantially treat am. It go mend, but then it not go well fine. Then you come back again. Then if you don't practice proper hygiene, sexual intercourse at times can cause am. Then condition like diabetes, sickle cell can cause am. Then adolescent, it common within adolescent people then, because they engage in alcohol and some form of what erratic sexual practices. So that's how you get anything in this. So those risk factors are there. Okay. Then if you go to the hospital, they give catheter. Anything they introduce you that foreign body will pass through those organs. Either the ureter, bladder, or ureters is a risk factor for me to this infection inside it. So that's why in hospital, if they give blood, they put catheter for you. Because if I'm going to say now, oh, if that catheter don't give me no, they can put catheter for you, they operate you because they need for doing that blood a day. But antibiotics they give you, what they make sure not get time. But now a risk factor. So not one day make the catheter there for long. We could just protect 2-3 days, so make come out. You understand? So those things can be a risk factor for make you get time.
So woman that's more quick for develop urinary tract infection.
Well, I think both parties can just get the symptom as quick as it is, because if you look at the ureters of the woman, it's short, and from go to the bladder, it's quick. So in that situation, the woman can express them more quickly than even the man for make you get them. But as I said, until they differ from one person to another person, because if you get the risk factor, you will get them quicker than person who get risk factor. You see, so it can change from one person to another person. But are just the symptoms that we go know, like where they wet the bone, where they wet the heart, bottom of the heart. And then sometimes some situation will get fever.
So the rainy season gets any more for contribute for make people and they get urinary tract infection.
It's possible for make that happen. But I want to put more dry season.
How?
Because dry season you dey dehydrate. If one of the risk factor dehydration, wey dey better water. Because the kidney need for work faster because na the organ wey dey produce urine and need for the clean himself as the time dey be. So if you na person dey drink plenty water, e dey starve himself. E dey cause make the kidney not work and the tendency for make get urinary tract infection go be high.
Okay, Doc. Let's take first call and the program. Hello, good evening. Your name and who side the call from? Hello? 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 Well, who know they get this call up, say go call back again. And the program now, well, Body Talk, they come to you live from the Society for the Democracy 98.1 FM. As today inside the program, we talk about reproductive health and infections, sexual transmitted infections, urinary tract infection, yeast and self-yeast as the doctor don't talk about wetin are sexual transmitted infections, wetin dey cause them, and self wetin are some of the risk factor them. But as we dey now dey look at the urinary tract infection, you sef can call the number 077981981 077981981 na the number where you go call and ask question, make clarification or self can make a contribution at the program. The number for call na 077981981 077981981 na the number where you go call. So don't keep it. They talk about some of the things where they prevent you not forget urinary tract infections. Again,
Because
okay.
during the season,
So quick one before that. Lord, take
during the
this
season
call.
they lost a lot of water.
Okay.
Your body, because it plays cool, you understand. But notwithstanding, you can't just say you don't get her.
Okay.
But dry season, they lost a lot of water, they sweat, and then they drink back. So if they lost water,
So we
they
don't
drink,
get
you
this
can
call and this. Hello, good evening.
Yeah, mommy, how they do, ma?
Fine, sir. You name and who side the call from?
I think ma from you. Do you ask for me? What thinking cause for life in the sleep? They go na yard fast. I don't know what thinking cause that they sleep no more by itself.
Okay. Now,
they are-
Pekin or big pussy?
A big person and my wife.
Okay.
Age.
Waiting at the age.
They don't pass 30 now, they go to 40.
Okay. Thank you
Yeah.
very much for that question we asked at the program. The program now, well, Body Talk, it come to you live from the Society for the Democracy 98.1 FM. Today inside the program, we talk about reproductive health and infections, sexual transmitted infections, yeast and urinary tract infection. As we get the experts in the studio with we don't talk on look at then different infections then the number for call now 077981981 077981981 na the number for call and ask questions. So Doc, you go on for answer to Mr. Koma.
Yeah, so one is say the person they sleep too much. Two
And
is
the
say
toilet
the toilet.
also.
So the best I can advise them because it go difficult for my to get a clear cut of what that happen to them. Because it go either be get bacteria infection at the gut where they cause them. They sleep, then they get for take proper history and if you not get any other sickness, you're not the only dog, you know they abuse any other dog. So that for come out clearly and see. So the best I can say make you see a doctor, then make they go investigate them, then go get to the bottom. Because at the point in time, anything I give them just not gonna be 200% right. It will just be something or not something like this. But it will be fine, make it, then take a history, investigate them, then they will get the bottom line of it.
Okay. The number for call now 077981981 077981981 and the number where you go call and ask question, make clarification as we get the experts in the studio with we. So Dr. Jalo, waiting at the hygiene practice then where people for do for ceasing or not get the urinary tract infections.
Well, after sex, go wash yourself. But then if you go wash yourself after sex and then you want get belly, then you just allow the sperm for just to go down. Because when the sperm dey within the vagina wall, it gets certain enzymes where they break them down. Now make I tell you say you not going to see the sperm. So they break them down and allow them to make it swim for pass through the cervical hose and find itself within the fallopian tube for make the belly happen. So yes, that's why it's always good for your partner, if anything, they wanna sort her out so everybody go well. Because yes, now one thing now they forgo, you wash yourself, but if not somebody way they try for get belle. It man they go wash the seven one they wash themselves, you go wash everything out.
Okay.
Then belle no go happen. So I don't want to make that situation happen. So one washing yourself, that one we done day. Hygiene, that one day. Health education, proper checking. Not just wait make the thing happen. If you notice any symptom of what, burning sensation, suprapubic pain, small fever, where they wet the burn you, go to hospital, make them treat you so quick. So now what that we go able to prevent them for make you not get them. And then it's good probably if you get her, your partner set for the treater. So not to just one man show. Now both parties. And then for the sexually transmitted infection, then just stay with one partner.
Okay.
And well, for commercial sex worker also, I don't know what I would advise in that case day, because it's been done for commercial.
But they say they use condoms, so in any way that they prevent them.
Well, you go prevention to some extent, but even the condom, how hygienic the condom is, where they handle out your hand, you can still introduce infection there.
So how for handle the condom?
Well, I think that they are talking for another day.
Okay.
Well, you keep your hand on the very but if you're not hygienic, you understand? Because even for prevent UTI, we say hygiene. You hand dirty, and then probably, mind you are sleeping with this, sleeping with that, and the process in between, you know, you didn't practice any hygiene. Along the line, something along the fluid, they fall along. So it does still protect you. So it has to just be like hygiene, then education. Regularly they check themselves and see who's in there and then treat themselves. Because you're going to know the other party when they come, especially the commercial workers. So, which is something they cannot tell. But they just have to be up there for make sure see they go hospital regularly, they check themselves.
Okay, so the using of scented soap for was private parts, especially for women them, get anyway for make you get infections.
Yes, because first of all, soap is sodium hydroxide or potassium hydroxide, and the vagina is acidic. So mind you, you are dealing with an acid and an alkaline. If you look the pH score, below 7 is acidic, above 7 is what alkaline. And you know, see the vagina of all start to tell you say now a acidic medium because lactic acid, glycogen in the presence of estrogen, they convert them to what lactic acid, where they help for keep the pH of the vagina fine. So if you don't want, you go use potassium hydroxide with the alkaline. You they wash. What they do? They push the pH of the vagina up. So what do they allow? You they kill the lactobacillus vaginalis when they inside there. When a bacteria, when they got put on there for protecting the human. So what did that allow? They allowed you for make infection thrive. So using soap for put on it, not fine.
So what's it for what?
Ordinary water.
Okay.
Lukewarm water, just slap it. Don't carry your handy. You can just separate the labia and slap water there. Finish. Nothing else. No oil. No douching. It's not fine. Because if you douche, you go get abrasion. Now the mucosa of the vagina. And once you get abrasion on the mucosa of the vagina, you know what will happen. Sex is not something that for say easy going. It's a friction, and that friction can be traumatic. And then this man is coming, he's traumatic, and he gets something, you don't get abrasion. So by the time you eat HIV.
Okay. So the use of lubricants in any way gets any way they do to the human vagina.
Well, then get sex thing the way they use for help. So it depends on the context, because also if you don't hit menopause, because you don't hit menopause, your estrogen level they go down, so they get what to call atrophic vagina, and then all them protection mechanisms are expected they come. So even doing sex, you get dyspareunia, very painful. So okay, advise you say better use vaginal gel.
Okay.
So it can work, but well,
you go can't tell me if you get any law take this call now the program. Hello, good evening. In name and who call from?
Yeah, good evening, Carissa. Good evening, Dr. Jallo. I was trying to talk from Manchester. How are they do? Yeah, Doc, thank you very much for giving that explicit explanation. Now, just one or two things I want to ask. I don't know this hepatitis B, even though directly, not sexually. Now, sexually transmitted disease, of course, but it can get out from other fluids, body fluids. But I'm concerned because the nerve system, most of the time, remember, then they're exposed to fluids and other things, them like needles But I don't know how much campaign or government plan for let them introduce that compulsory or as a kind of a discount or cost recovery for letting nurses then will get a compulsory gonna train they forget before they start their work after their training. So how much you are go able to lobby for that? I mean it's not go easy, but how much challenging are we able to put up for let government go help? And then regarding this other area of this vulva and then the female and the male reproductive one. I don't know the advice you would give women then in terms of how the cleanliness, whether to wash the vaginal side, because it's different from the urethra because the female urinary side inside the wet, it get up small. So how much cleaning will be required for that side today? And then the pH level for the vulva and then the small and the major lips. So all this, I don't know how much you go able to recommend for the woman and go they follow those rules because the money on a different issue. So thank you very much and let God continue for helpful and good work. Thank you, sir.
Thank you very much, Usfred from Manchester City. So, Dr. Jallo, you don't. So, clarify first if that need cause if the.
You can get time to that one day. Yes, if possible. Yes, you can get hepatitis through contact.
Okay.
Because through the blood product, if you get tear and so on, they come together. So that's a possibility for make you get them. But it mentioned say back the Minister of Health for help. I will say there was some time when Minister of Health they give vaccine, hepatitis vaccine to health workers.
Yeah.
So now intervention with government or Minister of Health kick out once in a while when there is need because then get statistically look at health workers and so this may be. But I will not be in a very good position for able to tell you. The Minister of Health, me and boss, and they go tell you when that time reach if they need for kill health worker there. You understand? And they'll get an infection disease secretariat where they take stock of all the things they are. But notwithstanding, if government don't provide for you, you health now you health. So go back for you health worker, make sure you vaccinate yourself. You get 3 doses where they take 0, 1 month, and 6 months for protection on a lifelong. And not too expensive. So you don't go wait till pass Minister of Health can give you can go and then you take them for your protection, especially if they play with blood products as the case may be. But that's why you always using IPC. Now we'll speak to them. We're very effective. We wear gloves them. Cleaning they be done effectively. Once you do all that, then you reduce for me health worker get that infection can be very, very minimal. And they operate a lot. So they take all measures there for make sure say I not get infection.
Okay.
You know? So if they also talk about cleaning. Well the cleaner me go just say warm water, lukewarm water is sufficient. You understand? For the woman, for make it happen. Unlike for UTI, drink plenty water. If they drink plenty water, for me get a tract infection, it's not easy because it happen. Those bacteria once they attach themselves within the water, they get for climb, they get certain appendages so they allow them for climb. So if you drink plenty water, what will happen? It will flush it out as quick as it be, you know. So we can say drink plenty water, then after sexual intercourse, go with inside. But if you get any risk factor of any disease condition, whether not diabetes, whether not congenital abnormality, whether not sickle cell, we get side where they treat them and then they make sure they cover them all for their condition in the. So you don't go get diabetes to not host, then you know to make sure you don't get sugar control, you not go fine. Or you get sickle cell, you need to go now the sickle cell society for me they treat you and cover all that in there. So that will be a very good advice for me, but if you get her, go make them treat you and then you can take care of that one day.
So what thing they cause dryness per woman?
Well, plenty is they call dryness actually. So first of all, if you don't reach menopause, you go dry. Because that estrogen they produce, any kind again, the ovary they produce estrogen, so you go dry. Other women and they naturally they can go to call premature ovarian insufficiency. The ovary not just they produce. You understand? Well, other conditions they way can just make the woman dry. For some reason, I don't get plenty patient like that. They say they dry. So, but when you find out what are the dryness, really look, you see say they get a lot of vaginal mucosa, or sorry, vaginal secretion when they come out. Because the secretion of the vagina, you get different things where they produce them. You see, you get mucus producing cells in the vagina. You get the Bartholin glands where they produce. So they all they produce. Sometimes a day, woman they can be dry because the Bartholin gland don't be infected. In short a way that they produce no mucus, no nothing. So you nothing that they go find for make they evaluate you properly. But if woman don't pass menopause, it will get dryness. Because they produce no estrogen again.
Okay, so doc, this person send this message at 077921921 and they say, "Good doctor, when the body becomes resistant to antibiotics, is there another remedy?"
The body not just become resistant to antibiotic because you don't abuse and take you don't take am substandard. When they say take am 7 days, you take am 2 days, you left am. If I dey fetch with you, you begin blow me, wetin dey happen? I dey go pick zeal for you more so that next time wey you wan come, I go fetch you. So you have to listen to wetin the doctor tell you. If they say 5 days, take am 5 days, 7 days, take am 7 days. You understand? Then not to everything now you just dey go take antibiotic for abuse am, as the case may be. Because abusing it basically can mean e no worthwhile it. And then you dey take the correct antibiotic based on wetin the organism wey dey cause the UTI or the STD as the case may be. But notwithstanding, we go to call syndromic management of sexually transmitted disease. With syndrome, with symptoms, then you can treat her.
Okay.
But that treatment dey na doctor for meet.
Okay.
Not just take normal all kind medicine.
So Dr. Jalo, let's take this call na the program. Hello, good evening. You name and inside the call from.
Good evening. Good evening. How are you doing?
Fine, sir.
No, we are listening to misunderstand the doctor here really talk about public water doing the guy sitting.
For waiting?
What he talk about doing the guy sitting.
Yeah.
So I don't know that mistake. He said nobody if you take no water, they stab the kidney, they eat, they stab the kidney.
Okay. Well, doc go make clarifications so that they just take what you say. Maybe na you go not misunderstand them. Okay.
I don't get it clear wetin you
He
talk.
say, you don't know if na misunderstand, they misunderstand it, but he say during the dry season for they drink enough water.
No, well, you are drinking water is fine naturally. It help actually for remove all toxic substance because the kidney, some of the things they eat medication or food them, the kidney are one of the organs where they excrete harmful substance, they metabolize them. So drinking water is fine. So I know they say not for drink, but when the season you know they sweat too much. So you get more rehydration, dry season they sweat. So when they dehydrate, if I make you add more water so that you don't go dry because when you dehydrate, the risk for getting may get UTI high.
Okay.
I know say no get any in the season.
So let's take another call na the program. Hello, good evening. You name and inside the call from. Okay, go ahead and ask your question.
How do you even?
Fine, sir.
Yeah. I the wet fast there, they didn't work water. I don't know.
Okay.
I sweat too much.
Okay, plenty. Thank you for that question. We asked na the program. Yes, doc.
Well, you go definitely for evaluator for medical condition, metabolic disease conditions, either diabetes or other thing. You understand? Make you see why it happened to him. So it's not something you go because you can tell and say that this happened to him. You know, but naturally, when you get a tract infection, a man or woman, you try for weight fast. Why? Because it's natural. You want to remove the bacteria or the causer. It irritates your bladder. So sometimes you get UTI, sometimes you get diabetes. I don't know what you get. But the sweating, basically, I'm not going to tell what's in the cause at all. If you get a lot of sweat gland, you go sweat. Now the place, outside this one, the place too jam packed, so you go sweat. You see, but it's good for making you see a doctor, the evaluator, then they treat it appropriately.
Okay.
Based on
So,
what you present with.
Dr. Jalo, what think it cause where mostly women man them feel for wet, then they go to nap for wet, the wet they delay for come out.
Well, first of all, look at the age of the man.
Okay.
Looking at the age of the man. So if you get gonorrhea if untreated, it will lead to urethral blockage. If you get a prostate, if you're a man, we don't pass 40 years, you know, see they get some hesitance, difficult for passing. If I may evaluate you, we get urologist here, Professor Tibi Kabara. Then one Dr. Ba also who do urology. So you go family evaluate, check your prostate. If you're a man, we don't pass 40 years. You see, because it's not just easy for me to go to nap because the urethra get a valve. So once you turn up, now reflex, it open for me wet. So if you're not wet, then they need for evaluate you, then check your prostate. So I tell you, don't get a tract infection will not be complicated.
Okay. So Dr. Take we last call on the program. Hello, good evening. Name and inside the call form.
Yes, me not Sally. I call from AC.
Okay, go ahead and ask your question, Sally.
I invest strong in the act. I mean, books on the part. Like, whenever in the period, these books are going to be asked everyone. Like, I feel something strong bone tightness.
Okay.
Na
So
last severe discharge that for any more period.
okay. So Salele, you don't want picking?
So,
Okay.
when I wanted to just share a number, maybe I will
Okay.
go to one for personal.
But he's sexually active.
Yeah,
Okay. Thank you very much. Okay. Okay, Dr. Jalo, you go quickly respond
Yeah,
to
so
Sally and we'll round
now
up.
dysmenorrhea they get because they mess in the heart. Not so?
Yes, yes.
So
Same
it
belly,
can,
bottom belly, the heart
yes.
serious one.
So it can be PID, adenomyosis, endomyosis, it can be cyst, you know. So it can be various things can happen. It can just be certain nothing not doing, not just respond of hormonal process to the mess system. So all you get for do first, once you say not doing where they mess, now it happen to her. Well, look evaluate her. If you get fibroid also it can cause that one. So you go just need for make we see them and then investigate them properly and assure them. There are medication we give for that day if that happen to them. Sometimes they not do anything to them. I just the hormonal process they respond. Or sometimes there's some pathology dey, as I mentioned and condition dey. Then they can evaluate it until they appropriately because we don't go about game one tomorrow.
Okay, so Dr. Jalo, now you the California in the studio, waiting could be message out there to people, especially the one that is sexually active.
Well, sexually transmitted infection, not to one man show. Now both parties or couples. So if you get you have go. Now hospital, the doctor say once you now for go make them treat you. Because if not, you go get you the man, you say everything fine, and then what you go happen, the woman go down where then you get in a low form, you go transmit them back to her. So now something where both parties for treat themselves. And then law we take hygiene very, very important because your body, your health, and wealth. And for make you not get sexually transmitted infection because now that organ they we responsible for procreation for making born picking. If you begin get problem, then what will happen? You don't go get picking.
Okay, so during this rain season, we too for watch out for prevent yourself.
Well, hygiene, one. If you don't get close way, you don't soak. Don't just go wear them. Iron and make sure say it dry fine. If you soak rain, soak it where you can please, not just go in down. Wash yourself fine. Huh? Then drink plenty water at all time. And then take all the measures I don't tell you. After sex, make sure you do hygiene. And then regular screening. Anytime you feel anything, if you do any season yourself, go make doctor see you and evaluate you.
Okay, plenty thank you. In name now Dr. David Jalo, in a specialist obstetrician gynecologist and senior registrar at the University of Salon Teaching Hospital Complex. As today inside the program Well Body Talk, we will talk about reproductive health and infections, sexual transmitted infections, yeast urinary tract infections, and especially during the rainy season where more of that they can happen. Plenty thank you we joining the program and plenty thank you to the one they always call, ask question, make clarification at the program. And well now this edition of the program Well Body Talk go left you for today, Thursday, July 2nd, 2026. Plenty thank you to my producer Musa Kamara, DJ Madi for in technical support. Mary Kamara Bangwa make una watch you live on our Facebook page. And we'll bring come to another edition of the program Well Body Talk. My name is Karifa to contact they say. Don't forget for listen next week Thursday from 5 to 6 o'clock even time again as we will come up with another topic we go help for educate the people and plenty thank you. Bye bye.
Thank you.